good evening everyone. We'll wait for 5 more minutes to let others join and then we can start. I guess we can start. Let me just share my screen. Am I audible to the rest of you? Please let me know if you're not able to hear me or if you're not able to see my screen in the presentation in a full screen mode. Is it all right? Yeah, I hope I'm audible. Okay, so good evening everyone. Welcome back to week 3 of NPTEL course session, Drug Delivery Principles and Engineering. So this is the third week that we'll be discussing today, and I think we can start. So before moving on towards the actual points discussed in week 3 lectures, I'll just go over two numericals which were present in the old assignment. This will just give you an idea of how numerical questions will be framed for your final exams, and it will also help clear up some concepts. Right, so I'll just display the question on the screen, and you people can take some time to solve this question if you want to, and I'll wait for few minutes. If not, then we'll again discuss at the end of few minutes. So the first question is, a polymer is made up of the following composition. It has 10 moles molecular weight of 40,000, 15 moles with molecular weight of 45,000, and 5 moles with molecular weight of 50,000. And we have to calculate the polydispersity index of the polymer. So if you people know the concept of polydispersity index, I think this would be very easy to solve. It's okay even if you don't have the exact answer right now. You can just let me know how you're going forward with this question. So I'll wait for a few minutes. I'll let you read the question, and at the end of your time we can discuss what the answer is. Alright, so people who have joined right now, I am just displaying a question in front of you on the screen. I hope it's visible to you, and I'm also audible to you people. It's a numerical which was there in some of the old assignments for this course, and I'm just giving you a few more minutes to read through the question and solve it if you can. If not, then just you can just let me know what is your approach in solving this question, and yeah, we'll discuss the answer as well. So please go ahead and let me know if you people know the answer. So you people can also tell me the answer in the chat box. If you have any other questions, you can chat with me in the chat box, or you can unmute yourself and just start speaking. Does anybody wants to volunteer for this particular question? You people can hear me, right? I am audible to the rest of you in the meeting. Okay, I guess most of you must have figured it out. If not, I'll just discuss. So we have to calculate the polydispersity index of this particular polymer. So to calculate the polydispersity index, we first have to know two quantities. One is the number average molecular weight, and another is the weight average molecular weight. Yeah, so these are the two formulae to calculate the same. This one is the number average molecular weight. This is the weight average molecular weight. So we already have all the data that we need to calculate this particular thing. So in this picture here, I have calculated it and I have put it here. So we'll just go over it one by one. So we have to first calculate number average molecular weight. This is nothing but an average of all the polymer chains that you have given here. So you just put it in this formula, in this particular formula. So you have 10 moles of the polymer which is having 40,000 molecular weight. Then you have 15 moles of the polymer which has 45,000 molecular weight, and then you have 5 moles which has 50,000 molecular weight. So to calculate the number average molecular weight, you just use this particular formula and then you'll get a value. Similarly, you have to calculate the weight average molecular weight, which is given by this particular formula, and then you'll get a value. So what does polydispersity index mean? It is nothing but the ratio of the weight average molecular weight to your number average molecular weight. So if you take a ratio of these two quantities, you'll arrive at an answer of 1. So polydispersity index is a value which tells you what is the distribution of the polymer chains in your particular polymer, right? So your polymer is made up of different lengths of chains, so they are definitely going to have different weights. There will be different amounts of chains with different weights. So to arrive at a polydispersity index, you have to calculate two quantities: weight average molecular weight and number average molecular weight. So this value just tells you what is the distribution of your particular polymer. So yeah, so for numericals, please keep it in mind, there will always be a range within which your answer should fall. So if your answer ranges from zero point 0.7, anything between 0.7 to 1.3, it's a correct answer. So we have the value as 1, so we have the right answer with this. So this is how your numericals will be there in your final exam as well. So it will always have a range of values. So yeah, does anybody have a doubt with this explanation, or is anything unclear in this question? I can go over it again. Just let me know if this is clear. Is it all right? If there are no doubts, then I'll move on towards the next question. Or if anybody has any doubt, we can also discuss this question again at the end of the assignment. That is also fine. Okay, if there are no doubts, then I'll move on towards the next question. Okay, so the next question is a drug A is injected into a patient. The rate of elimination of A is 25 grams per minute and its plasma concentration is 5 mg per ml. So we have to calculate the rate of clearance of the drug from the body in the unit of liter per minute, and we assume that the drug is distributed in the total body water. So we have the rate of elimination, we have the plasma concentration, we just have to calculate the rate of clearance. So if you know how rate of clearance is related to both rate of elimination as well as plasma concentration, this should be a pretty straightforward numerical. So take some time, read through the question, and if you have a pen and paper, just go ahead and solve it. I'll wait for a few minutes. If nobody is getting the answer, we can discuss the answer as well. I also have the calculation for it. But I'll wait for a few minutes for you to go through it. Let me know if anybody knows how to solve it, or does anybody already have an answer. Anyone wants to volunteer for this question? No one? Okay, let's look at the answer. So this is how clearance is related to rate of elimination and plasma concentration. So we already have the values with us. So the rate of elimination is 25 gram per minute, plasma concentration is 5 mg per ml, and we have to calculate the rate of clearance. So pretty straightforward. You just put it into this formula, divide the rate of clearance, rate of elimination with your plasma concentration. But the point to note here is you need to keep an eye out on the units here, because we are supposed to give the answer in the unit liter per minute. So we see here that we have grams here and mg here, so make sure you have your eye out on the units as well. So if you do the correct unit conversion, you will get the answer as 5 liter per minute. And if you look at the answer that is correct, It ranges from 4.8 to 5.2, so anything that falls in between this range is the correct answer. Somebody is trying to say something in the chat box. Okay, somebody has answered it, but I think you forgot to keep an eye out on the unit. So it is 5 liter per minute, not 0.005. Is this clear to you, whoever has answered in the chat box? So since we have ml here, we have to convert that to liter first, and then you make this unit same. You either keep it in grams or mg, whatever you feel like, because it eventually gets cancelled, but it has to be in the same unit for it to be cancelled. And yeah, you convert your ml to liter and you'll get the answer as 5. Is this clear? Okay, cool. Thanks for answering. So these were two numericals which I just wanted to give you a glimpse of. We will be discussing even more numericals as and when we get them in the assignment, so that's not a problem. But if you people have any doubts in this, you can ask me later on, or you can write it in the chat box and we'll take up the question. So let's move on with week 3 points. So sorry to keep on changing the screen a lot. I'm just adding new people as and when they join. So let's discuss some of the points that were taught in week 3 lectures. So far we have looked at for week 1 as well as week 2 lectures. You people must have followed both these week lectures. So we have been talking a lot about drug delivery systems and some basics related to drug delivery systems. And since the last few lectures of week 2, we have started talking about the actual drug delivery systems. Somebody wants to ask something, so Dhananjay, you can just unmute yourself or chat in the chat box. You don't have to raise your hands, that's okay. Do you have a doubt? Do you want me to stop or discuss something else? I assume not. If you have any doubt, you can write in the chat box. I'll take it up later on. So as I was saying, we are discussing about the drug delivery systems, right? So we talked about making prodrugs out of drugs to help us with solubilizing some of the hydrophobic drugs. Then next we talked about protein polymer conjugation, wherein let's say your protein is a very small molecule. There are chances that it will get filtered out from the body very easily. So to avoid that, you conjugate it with PEG chains. PEG is nothing but a polymer, polyethylene glycol. And this is one of the ways to deliver your small drugs or small molecules and help them retain in the body for a longer time. So this was another example of a drug delivery system. At the end of week 2 lectures, we also saw something known as reservoir system. So reservoir systems are nothing but this is a supersaturated drug in non-erodible polymer membrane. So what this essentially means is, so what does reservoir system mean? So let's say you have a drug core and on the top of it, on the surface of this drug core, there is a non-erodible polymer membrane covering this entire drug core. So drug core meaning the drug is at a very high concentration inside this particular system. You have a non-erodible polymer membrane over it. So this membrane will have pores inside it. And once you deliver this system to a patient's body, because of the fluid movement, because we have a lot of water movement going on in our body, so wherever you deliver this system, water will enter into this particular system, and because of diffusion, some amount of this drug will keep on releasing from this porous non-erodible polymer membrane. So this is an example of a reservoir system. So we also learned about lag and burst effect with this. So we'll talk about this in one of the questions in the assignment as well in detail. Next was, so this is all about a reservoir system. Similar to that, we have something known as metric systems. So the difference between reservoir system and metric system is this. Reservoir system has a concentrated drug core above which on top of it you have a polymer membrane. On the other hand, metric systems are nothing but you have your polymer and the drug is distributed evenly throughout this particular polymer. So it's just like a sphere kind of thing, and wherein you'll have your drug. Now this could be of a non-erodible metric system, or this could be a bioerodible metric system. What does this mean? So if you have a metric system made up of a polymer which is non-erodible, you will have something known as a non-erodible metric system. But if you want your polymer membrane or the polymer that you have used to erode over the time, you can also use bioerodible metric systems. So all of these drug delivery systems will have their own advantages. They'll also have their own limitations. So what we need to keep in mind is whatever application you're using it for, whatever disease you're trying to treat or whatever disorder you're trying to treat, which route of administration you're using for delivering these particular system, all of that will govern which method you should go ahead with. So these are there are a number of options available to us to deliver particular drugs. What we are going to choose depends upon its application. So your non-erodible matrix system is nothing but wherein a drug is well distributed in a polymer matrix. The limitation for this particular system is it requires surgery. So because it's non-erodible, you'll have to do a surgery first of all to implant this system into the patient's body, and after its job is done, because you'll have some specific amount of drug in this, you're trying to treat the patient with this drug. Once all the drug is released, once the patient is relieved of the disease, you'll also have to remove this from the patient's body, right? Because this is a foreign element you have implanted into a human body. You can't just keep it forever there. That will have consequences later on. So you have to perform another surgery to remove it. So this could lead to low patient compliance. Patients will not be very happy that you're doing surgery on them twice. So that is one limitation of non-erodible matrix systems. To avoid this, you can use something known as bioerodible matrix systems. So for these particular systems, the release of the drug depends upon the degradation of polymer. So the way your drug gets released from these systems will be because of diffusion, because of the pores in this polymer, and also it will depend upon the degradation of polymer. So since you have used a bioerodible polymer, it will break down in byproducts, and then from that slowly the drug will be released. So one good advantage about this system is it is more patient compliant. You have to do surgery only once, and since it's bioerodible, it will eventually go off from the patient's, will be eliminated from the patient's body. So you don't have to do another surgery to remove it. That's advantage. Limitation for this is the byproducts which are being broken down because of the degradation of this polymer, they could cause toxicity. They might not be as biocompatible as the non-erodible matrix system. So this could lead to further problems. So all of these we need to study first and then choose a particular drug delivery system. Is this clear? You people can let me know if I'm going too fast, or if anything is unclear in the explanation. We can discuss the point again. Is this clear? Okay, I assume there are no doubts with this. Yeah, so the next important point in drug delivery systems is hydrogels. This is a very extensive amount of research has been going on using hydrogels for drug delivery systems. So what are hydrogels? Hydrogels are nothing but a 3D hydrophilic polymer network which is capable of swelling in water. So for example, you can take jelly. Everyone must be knowing what a jelly is. It has a lot of amount of water. Or if you people have ever encountered magic balls, I don't know if you people know this. So these are nothing but these are made up out of polymer. The moment you put it in water, they'll swell. So that is the concept with hydrogels as well. These are 3D networks. They are made up of a very hydrophilic polymer. So this hydrophilic polymer helps in retaining a lot of amount of water. But the polymer network is also insoluble. It is held in place because of physical and chemical interactions, which gives a kind of sturdiness to this particular polymer. So the moment you put it in water, it comes in contact with water, it will just swell. And you can make hydrogels bioerodible, or you can make it non-erodible depending upon what your application is. So these are swelling controlled hydrogels. So what happens is once you make this formulation, you can trap a drug inside this hydrogel and keep it in a dry state. So when it is in a dry state, the hydrogel will have a very small pore, and the pores will be even smaller than the drug size. So the drug will not be free to move outside of this hydrogel. So you can easily store these hydrogels. Whenever you want to use these hydrogels to deliver drugs to a patient, you can just deliver them, and when these hydrogels come in contact with the water in the patient's body, they'll start swelling. Once they swell, the pore size will increase, right? So it has now collected a lot of amount of water, and now it is swelling. So it will in that process, the pore size will become bit more than what it earlier was. It will become even more than the drug size. So now the drug is free to move outside of this hydrogel. So once it comes in contact with water enters into this hydrogel, your drug will start diffusing out of this hydrogel. So that is one way to deliver drugs. So that's an advantage where you can have a controlled drug release using hydrogels. The limitation for this drug delivery system is it might not be suitable for all delivery routes, right? So let's say I'm trying to deliver a hydrogel using intramuscular or intravenous route. Intravenous route, what does that mean? I just put it directly into my vein, And why this could cause problems is because when it's in a dry state, it's of a very small size. It can easily pass through the veins, through the capillaries once I put it intravenous. But once it comes in contact with water, it will start swelling. So the smallest capillaries that we have in our body are somewhere around 5 micron. If the hydrogel swells even uh, up to, let's say, 5 micron, or if it goes beyond that, it will start clogging my capillaries and the veins. So this could lead to problem, right? That be an obstruction in the blood flow. So no matter how good amount of hydrogel, or you have designed a very nice system for drug delivery, if you don't know the consequences of the route of administration, it's going to be a failed therapy. You'll create even more problems for the patient rather than treating them. So before deciding upon what drug delivery system to go for, we need to know about all the routes of administration. We need to know what might happen if you introduce a polymer through different routes of administration. So that's one limitation for swelling controlled hydrogels. And so hydrogels can be divided into two types: physical and chemical. So physical hydrogels are nothing but these are networks which are held together by physical bonds. So these bonds could be ionic, these could be a hydrogen, or these could be hydrophobic bonds. So there is no covalent bonding, there is no proper very strong bond holding these interactions together. So that's why these are known as physical hydrogels. On the other hand, we have chemical hydrogels. So these are, as the name suggests, they have covalently cross-linked networks. Or both of these physical hydrogels and chemical hydrogens have their own advantages as well as limitations. So as I said, everything depends upon the route of administration and the application that you're trying to treat in a patient's body. So these were some of the points, key points discussed in week 3 lectures. With this knowledge, then we can, it will help us in solving some of the assignment questions coming up. Does anybody have any doubt in any of these concepts discussed here, or any of the concepts which you might have come across the lectures which was unclear? We can discuss them now. If there is no doubt, then we can go ahead with the week 3 assignment questions. Is it okay? Okay, any problems here? If not, then I'll move on towards the questions. Okay, I assume that there are no doubts here. So let's look at some of the questions. The first question, I hope you people can see it displayed on the screen. Let me know if you're not able to see the questions as well. The first question is, which two statements are false? So this is regarding reservoir system and matrix system, which we just discussed right now. So we have to choose two correct answers for this. So if the question is asking us which two statements are false, so please read through the question and the options carefully, and if anybody knows the answer, if anybody would like to volunteer, please let me know. I'll wait for a few minutes. Anyone has the answer, you can unmute yourself and let me know, or you can write it up in the chat box. Okay, If nobody is volunteering, let's look at the answer. So the correct answer is drug release from reservoir system is controlled by bulk erosion. Drug release from matrix system normally follows zero order kinetics. Both these statements are false. So let's look at what reservoir system and matrix system actually is. So we discussed it briefly at the start. So reservoir system is nothing but, as I was saying, it's a super saturated drug reservoir. There's a drug core. On top of it, it's surrounded by a non-degradable polymer membrane. So this is how, the way the drug will be released from this system is because this polymer membrane is porous. With time, because of diffusion, since there is a lot of amount of drug here, wherever you will be implanting this particular system in a patient's body, surrounding it there will be very less amount of drug, right? So the drug will flow from this saturated core to the outside. So the advantages of the system are, it has a zero order release. Zero order release meaning the rate of release will only depend upon, it will be governed by how the drug is flowing out of this particular system. So it will have a constant drug release. It will not depend upon how much amount of drug is there inside this particular membrane, because no matter how much amount of drug you add, it will always be governed by this porous polymer membrane. That's why it's easy to control these kinetics by changing this device parameters. So you can have it into this planar configuration, or you can have a spherical configuration. So this is what a reservoir system is. So if you just look at the options, so the drug release from reservoir system is controlled by diffusion. That is the correct statement. Drug release from reservoir system is controlled by bulk erosion. That is false, because reservoir systems are made up of non-erodible membrane. So there is no erosion happening here. The way the drug gets released is only controlled by diffusion of the drug. So your second statement is false. You have the first, the correct answer for this question, since it's asking us two statements that are false. So you have one statement that is false, that is option 2. Next is your matrix system. So this is about reservoir system, right? So this is how a matrix system looks like. So it's nothing but your drug is dispersed all over in this polymer, and with time, so it's a non-erodible matrix system. It could be an erodible matrix system also. So because of this porous polymer, your drug will then be diffused out. So the advantages of this particular system are, it's easy to fabricate. You don't have to put drug inside a polymer membrane. You just mix your polymer and your drug together, and over time the polymer will cross-link and will trap your drug inside. So it has less severe problems with leaks and cracks, and it can be suitable for high molecular weight drugs. The limitations for this system are, since these are non-degradable, as I was saying, you have to do surgery twice, once to implant it, and you also have to remove it at the end of the delivery period. And also the release rate is not generally zero order. So let's look at the options here again. So the third option is drug release from matrix system is controlled by diffusion. Yes, it is controlled by diffusion. Drug release from reservoir system normally follows zero order kinetics. That is what we saw. Drug release from matrix system normally follows zero order kinetics. That's not correct. They don't follow zero order kinetics. So you have your second answer right here. So the correct answer was option 2 and option 1, 2, 3, 4, 5. Option 2 and 5. So if you people had already known the answer, you can tally it with the answers displayed on the screen. So is this clear? If anything with the explanation seems inadequate or it's a little bit confusing, you can let me know. I can go over the explanation once again. If there are no doubts with this question, if it's clear, then I'll move on. Is it okay? Please let me know if there are doubts with the question, or if any concept is not clear. I can repeat the explanation again. Okay, if there are no doubts, I'll move on towards the next question. So the next question is, what are in situ cross-linking hydrogels? Are these polymers cross-link at the site of injection inside the body, or cross-link polymers are introduced at the site of injection? Hydrogels which release growth factors upon stimulation by tissue microenvironment, or polymers which contract when inserted in vivo? So 4 options, we have to choose one correct. So if you people know what in situ cross-linking hydrogels are, let me know the answer. If not, we'll discuss at the end. Somebody's answering in the chat box. Option 1, polymers cross-link at the site of injection inside the body. Okay, thank you for answering. Let's see if anybody has any other response, and then we'll discuss the answer. Thank you for answering. Anyone else wants to give it a try, or does anybody have another opinion other than option 1? Okay, I guess not. Let's look at the answer. So, whoever answered in the chat box, you're perfectly correct. The correct answer is polymers that cross-link at the site of injection inside the body. So that's what in situ cross-linking hydrogels are. So this get cross-linked. So you have your syringes ready, and let's say you have two different components that you're trying. You have two syringes. One has the polymer, one has the drug. You inject both in the patient's body, and that's where your hydrogel is going to form. So the concept of hydrogels that we discussed, what we were discussing was you already form the hydrogel and then you implant it, or then you inject it into the patient's body, or you can have something like in situ cross-linking hydrogels. You have your material, raw material ready with you, you inject it into the patient's body and it forms a hydrogel inside the body. So there could be various different polymerization triggers for it. It could be time, it could be temperature. Let's say at outside temperature it does not polymerize, but once you put it into a patient's body at 37 degrees Celsius, you will see that the polymer is cross-linking, and in the process of cross-linking it will then trap the drug that you have injected, or it could be a pH trigger. So there are various advantages for in situ cross-linking hydrogels. Let's say you have a very nice hydrogel system, but it's a little bigger in size, and you're not able to inject it into the patient's body. So instead of implanting, instead of doing a surgery, you don't want the patient to suffer through that surgery. So you just take the components of these hydrogels and inject it into the patient's body. So then it will form a hydrogel inside the body rather than injecting the pre-formed hydrogel. So that's one advantage. It also has limitations, as do all drug delivery systems. So it might diffuse throughout the body, right? So you have your raw material, the polymer that you're trying to put, you have injected it, but you don't have a control over where that is going to flow in the patient's body, right? It might diffuse to other parts where you don't want the hydrogel to go. That is one limitation. The other is you have no control of shape. So let's say you're trying to make a hydrogel in the lab, you have certain amount of control. You can make spherical particles, but once you have put the polymer and the cross linker inside the patient's body, you no longer have a control of shape, right? It can form any other shape, and in that process it can trap the drug anywhere. So these are some limitations of in situ cross linking hydrogels. So to come back to the question, what are in situ cross linking hydrogels? These are nothing but polymers that cross link at the site of injection inside the body. Is this concept clear? I hope the explanation is making sense. If you have doubts, you can let me know and we can go over the explanation again. If there are no doubts, I'll then proceed towards the next question. No doubts? Okay, let's move on towards the next question then. Okay, sorry. Somebody is saying next question. Okay, I'm moving towards the next question. Next is physical hydrogels are polymer networks held together by what? Which forces can hold together the physical hydrogels? I think we discussed this briefly in the introduction as well, but go ahead and read the options and let me know if anybody has the answer. Would anybody like to volunteer? Anyone knows the answer? Okay, someone is answering neutral or ionic bond. I believe that's option 1. Okay, thank you for answering. Anybody else has any other answer other than option 1? Okay, let's look at the answer. You're perfectly correct, whoever answered in the chat box. The correct answer is physical hydrogels are polymer networks which are held together by neutral or ionic bonds. We discussed this at the start, right? So we have two kinds of polymers, physical and chemical hydrogels. So physical hydrogels are held together by neutral or ionic bonds. These are the primary networks holding together the physical hydrogel. Some secondary forces can also help, which could be hydrogen bonding or hydrophobic forces. So that's what a physical hydrogel is. Sorry. Yeah, this is pretty straightforward. Any doubts in this? I'm just pulling up slides from the professor's lectures only, so you might have seen this slide before as well. Is this clear? Okay, I assume no doubts, so let's move on. The next question is, in microporous hydrogels, pore size usually vary between what? So you have a bunch of options here. Let me know if anyone knows the answer. Anyone? Okay, this has a pretty straightforward answer. It's 100 to 1000 angstroms. That's what the pore size usually is for microporous hydrogels. So your drug has to be smaller than this for it to be released through this drug delivery system. I don't think any explanation is needed for this. I'll just move on towards the next question. Next is, which of the following parameters is an indicator of polymer crystallinity? Is it TM, is it TG, MW, or MN? You'll be able to answer if you know what these four abbreviations stand for. So let me know if anybody knows the answer. If not, we'll discuss in detail. Nobody? Oh, somebody's answering TM. Okay, sorry for the late response. Yeah, somebody has answered option 1. Thank you for answering. Anybody else? Okay, I guess no more responses. Let's look at the correct answer. You're correct. The right answer is TM, which is nothing but the melting temperature. So let's look at what melting temperature is and how it's related to crystallinity. So if you remember from the first few lectures from week 1, what crystallinity is, it's one of the parameters to characterize polymers. So if you have a polymer and if it has very ordered structures, sorry, anybody trying to say anything? I guess not. Yeah, so in your polymers, if your chains are in a very ordered state, it is termed as your polymers have some crystalline character to it, and this crystallinity increases. Yeah, this crystallinity increases if your melting temperature is higher, right? So what does melting temperature mean, or melt transition temperature mean? It's nothing but the temperature at which all your crystalline regions start melting. So if you have a very high ordered structure, if let's say all your polymer chains are in the correct order, have a very nice pattern to it, then it will take higher temperature for it to melt. So it means the more the crystallinity, more will be the melting temperature for your particular polymer. If your polymer chains are arranged very haphazardly, they don't have a proper pattern to it, it will take very less temperature to melt it. So that's how your melting temperature and crystallinity are related. More the degree of crystallinity, more will be the melting temperature. So amongst these options here, uh, yeah, so the question is, which of the following parameters is an indicator of polymer crystallinity? Melting temperature is the correct answer. Tg is nothing but glass transition temperature. It's more appropriately related to amorphous polymers rather than crystalline polymers. Mw is your weight average molecular weight, and Mn is your number average molecular weight. So molecular weight will not indicate whether your polymer is crystalline or not. So the correct answer is melting temperature. Is this fine? I hope you people are getting the explanation. If anything is confusing with this, let me know and I can go over it again. Okay, I assume there are no doubts. Let's move on towards the next question then. Next question is, what is lag effect for release of drug from a drug delivery system? And you have 5 options here. Uh, we have to choose only one correct option. So if you people know what lag and burst effects are, it will be easy to answer this. Let me know if anybody knows the answer. If not, we'll of course discuss it. Okay, both of you have answered as option 2, that is delayed release of drug from drug delivery system after implantation. Okay, thanks for answering. Anyone else? Can people please mute their mics if you're not answering? It's kind of disturbing the session. I guess no one else has a response. So yeah, both of you are correct. The right answer for lag effect is it's the delayed release of drug from drug delivery system after implantation. So let's look at what lag and burst effects are. So this is related to drug delivery system. So let's say you have made your system, and it's kind of a reservoir system wherein you have this drug core, and surrounding it you have your membrane, right? So what does burst effect mean? So let's say you are using this device, so you have made this device and you have stored it, and after some amount of time, then you are putting it into the patient's body. So it has been in the storage for quite some time. So what happens is, even though it's in a dried state, even though it's in storage, there are possibilities that from this drug core the drug might come towards the edge of this membrane, right? Since it has no water right now, it's not in contact with water, the drug is not able to diffuse out of the membrane, but it's possible that most of the drug is now lining your membrane, inside the membrane. So the moment you put this into a patient's body, there will be contact with water, and that's where most of the amount of drug will start releasing, right, before it reaches a steady state. So this effect is nothing but the burst effect. You'll see that a lot of amount of drug gets released at zero time, and over time then the rate stabilizes. So this is nothing but burst effect. On the other hand, you have lag effect. Let's say you have fabricated your device, you have this drug core, you have a membrane surrounding this drug core, and immediately there is a demand for this device and for this system, and you put it into a patient's body. So now there'll be some lag time. So the drug will take time to diffuse from the core to the membrane, and from the membrane to the outside surrounding. So that's where you will see a lag effect. So this is the delayed response of the drug to come out of this particular device if it's immediately used after fabricating. So you'll have some lag time, a very less amount of drug will be released over time, and then after that it will reach a steady state. So this is the lag effect. So if you look at the options, what is the lag effect? It's the delayed release of drug from drug delivery system after implantation. So it all depends upon how your device was made, how long it was in storage, and how you're using it. Is this correct? Make sense? If there are any doubts with this explanation, do let me know. If not, then I'll move on towards the next question. Okay, I assume no doubts. So let's look at the next question. Next is, what method is used to measure surface roughness? Nothing much to do with drug delivery as such, but yeah, a question nonetheless. So to measure surface roughness, what is the correct method? Is it differential scanning calorimetry, two-photon microscopy, dynamic light scattering, circular dichroism, or atomic force microscopy? If anybody knows the answer, please let me know. Okay, last option. Suchitra is saying last option, which is atomic force microscopy. Okay, thank you for answering, Suchitra. Anybody else has a different opinion other than last option? I guess not. So yeah, you're perfectly correct. The correct option is atomic force microscopy. Nothing much to discuss here. So atomic force microscopy is nothing but it has a cantilever needle or a tip which then scans your entire surface, and that's where you get to know how rough is your surface, what are the contours on the surface. So atomic force microscopy is used for that. Let's move on towards the next question. Next is the type of hydrogel that polymerize after injecting into the body are called. I think we just discussed this in detail, so this should be pretty easy. Okay, someone else was also trying to answer the previous question. Sorry for not looking at it. Yeah, any answers for this? Okay, both of you are answering as option 3. Pretty straightforward. We just discussed this in detail. Both of you are correct. The right answer is in situ cross-linking hydrogel. We just saw it, right? So there are hydrogels which you can make inside the body after injecting the raw material. So that those are nothing but in situ cross-linking hydrogels. The next question is, what is true for bioerodible matrix delivery systems? We have to pick two correct statements. Let me know if anybody knows the answer. Somebody is saying 3. Maybe that was for the previous question. So here you have to choose two options. So let me know if anybody knows the answer. Okay, two people have tried answering. Somebody is saying 2 and 4, somebody is saying 1 and 4. Let's look at the answer. Thank you for answering, both of you. The correct answer is, first of all, option 1, it's degradable and more patient compliant, and last option is can achieve first order with surface eroding polymer devices. I think there's some mistake here. This has to be can achieve zero order with surface eroding polymer devices. So that's the correct, I think some mistake with the last option. So what are bioerodible matrix systems? So we were just talking about these matrix systems, right? You have your polymer in which your drug is dispersed all over the polymer, and these could be non-erodible or these could be bioerodible. So what will happen in a bioerodible system is the drug will get released based on two phenomena. First of all, your polymer will be porous, so your drug will be released out due to diffusion. Also, since it's a bioerodible polymer, over time the polymer will start degrading, and that will also lead to a drug release. So the advantages are, first of all, it's degradable. You don't have to do another surgery to remove it, so it's more patient compliant. And if you, let's say, have a surface eroding polymer device, which means the erosion will start with will the polymer will always be eroded from the surface. So if that's the case, then you can achieve zero order. So because no matter how much amount of drug you put in, since it's only getting eroded from the surface, there'll be a constant rate of release. So it's possible to achieve zero order with surface eroding polymer devices. So these are the two correct options for bioerodible matrix system. First, it's degradable and more patient compliant, and it can achieve zero order with surface eroding polymer devices. Please make a note, it's not first order, it's zero order in the last option. There's some mistake with the option. So that's all the questions that I had for you today. If anybody wants me to go over all the questions again, if anybody has joined late and missed few of the questions, you can let me know. If not, then that's all I have for you for today's assignment, and we can meet next week, Tuesday, 6 to 8. Is it okay? Does anybody have any doubts or wants me to repeat few of the questions at the start? I can do so. If not, then yeah, that's all. Others who are I can end the meeting here. People who are still in the meeting, do you have any doubts or wants me to go over some questions again? I can do so. If not, so people who have just joining, I think we are done with. I think we're done with the assignment here, but people who are just joining can. Uh, you have a doubt, but it's not about the question. Okay, what is your doubt? Uh, Okay, so the question is, after clearing the exam, you'll get a certificate, and how is that certificate useful to you? Okay, first of all, I had given one course, and I was the first all over India in that course. So I received an internship option from this professor. So if so let's say you get into the first top 5 or top 1%, I guess there are options of doing internship in the professor's lab. So the professor will contact you in that case. So that's one advantage of doing this exam and getting a good certificate. You will get an opportunity to do a 1 or 2 month internship. That's possible through NPTEL. Other than that, it just adds to your CV. It just tells people that you are, other than your course curriculum, you are outgoing and you are very enthusiastic, you're very curious about topics. So you have done a course which is not in your regular curriculum. So that certificate will just add to your CV. I hope that clarifies your doubt. Plus, you'll get to know a lot, and it's usually, I mean, if you have an exam coming up, you'll just be focused in studying some of these concepts better than just learning about it. So yeah, that's how the certificate will help you. Is that clear? I mean, I hope I have answered your doubt. Anything else? Does anybody have any other doubt? Imran, I hope I have answered your. Okay, you are not submitting assignments. Can I be eligible for exam? That I am not sure about. I think you're still eligible for the exam, but your assignments also count for the end score that you get. I think it's about 5 or 10% of your final score is coming from these assignments. So I would suggest just go ahead and start submitting your assignments. I think first 2 weeks are must already be past the deadline, but you can start submitting from week 3 assignments. For the exam, I think you have to pay a nominal fee, and I think you should still be eligible for the exam. You'll get these details at the end of the course as well. You'll get an instruction sheet of how the exams go for. You'll get a registration link also. So you can also talk to, but here in website they mentioned some person. Yeah, so that's what I was saying. So some amount of your score will come from these assignments. If you want a good score, start submitting the assignments. If not, you just want to give the final exam, I think that should be fine. You can also talk to the current TAs of this course. You must be get you would be having some link from the NPTEL team to talk to the current TAs. I am just dealing with the old assignments as a part of my PMRF TA. So if you have any more doubts about the exam and the current course, you can talk to those TAs. They also have doubt clearing sessions some time of the week, some live sessions. So you should be having those details. Is that okay? Okay, sure. Any other doubts? If no, then I'll end the meeting here, and I can meet you people next Tuesday at 6 o'clock.
Okay, madam, bye.
Okay, thank you. I'll end the meeting then. Bye.